Genitourinary tract master pass, paper 1. Question number 1. CT scan shows left adrenal gland has bulky anterior limb with medium 2 cm with Hornfield unit of 18. Most likely diagnosed adrenal adenoma. This remember that the maximum anterior limb width is less than 1 cm. When it's 2 cm, then most likely diagnosed adrenal adenoma. And also see adrenal adenoma. There is a bulky anterior limb and Hornfield unit of up to 18. Question number 2. CT scan shows an enlarged right adrenal mass of 2 cm found with an average density of 40 HU. What is the appropriate next investigation? Unenhanced and enhanced delayed phase CT examination. Whenever we suspect an adrenal adenoma, we have to do unenhanced and delayed phase CT examination, not only simple CT examination, to find out the characteristics of the adenoma. Next question number 3. Neonate with a family history of autosomal recessive lipoidosis has hepatomegaly and splenomegaly. Punctate cortical adrenal calcification is seen on abdominal radiograph. What is the most likely diagnosis? Wolman's disease. Wolman's disease is a disease. It is autosomal recessive and consists of hepatomegaly and splenomegaly, and also it consists of a punctate adrenal calcification. So diagnosis is Wolman's disease. Question number 4. CT scan shows the right adrenal mass which is of predominantly lower donation. Several areas measure minus 100 HU and associated with reperitoneal hemorrhage. Most likely diagnosis myelolipoma. Because the CT scan shows the right side adrenal mass which is of lower donation and has several areas of minus 100 HU due to lipids. So diagnosis adrenomyelolipoma. Question number 5. SGN for persistent hypertension. There is increased aldosterone and decreased adrenal level. One investigator most likely to help a CT examination of the adrenal protocol. Because we are again investigating the adrenal gland and that we have to do unenhanced and delayed phase with the adrenal protocol. Question number 6. MIPG nuclear medicine scan is performed. How does advanced her management? MIPG scan is used to locate an extra-adrenal pyroglomeruloma. MIPG scan is used for pyroglomeruloma. Question number 7. Man with acute necrotizing pancreatitis. CT scan shows bilateral adrenal enlargement with an alternating of 75 HU. Most likely cause for this is adrenal hemorrhage. Because whenever a patient has acute necrotizing pancreatitis, then there is chances of adrenal hemorrhage. And when the alternation is 75 HU, that means there is active bleeding in the adrenal gland, means adrenal hemorrhage. Question number 8. What is the absolute increased risk? Okay, 1.5. This is an MCQ. Here there's calculations, and you have to. There's no time for calculation, so just memorize 1.5 in this MCQ. Question number 9. Breast lump shows a firm, discrete, mobile mass palpable in the right upper outer quadrant. Mammography is 1 cm, well circumfine, rounded, soft density in the upper outer quadrant of the right breast. What is the most appropriate management? Perform ultrasound and ultrasound guided core needle biopsy if the solid lesion is visible. This is easy and simple. There is a palpable lesion in the right upper outer quadrant. Question number 10. Which feature on ultrasound would favor a diagnosis of breast cyst over that of fibroadenoma? A hyperechoic posterior wall. This is a breast cyst, and it has a hyperechoic posterior wall. Question number 11. What feature would favor diagnosis of an oil cyst over that of lipoma? D. Demonstration of an eggshell calcification. Then oil cyst and has eggshell calcification. Question 12. With invasive ductal carcinoma, where in her breast is most likely to be located? C. Upper outer quadrant. Most of the breast carcinomas are located in the upper outer quadrant. Question number 13. Breast biopsy shows the breast carcinoma. Where is the most likely place for this lesion to initially have metastasized? C. Bone. B for bone, B for breast cancer metastasis. And ipsilateral exoderm nodes may be local spread, but it's not metastasis. Metastasis is to the bone. Number 14. Treated for invasive ductal carcinoma with a white local excision and an axillary clearance. With the following the most appropriate follow-up mammographic regimen. Every 6 months for the first 2 years and annually thereafter. After treatment for invasive ductal carcinoma, the mammographic regime is every 6 months for the first 2 years and annually thereafter. Question number 15. Which of the following feature makes a diagnosis rather than a breast cyst more likely? An increase in size in a postmenopausal period in absence of HRT. So, patient has a breast cyst, and if it increases in the postmenopausal period, then in the absence of HRT, then it means it is most likely malignant. It is not a breast cyst because breast cysts usually shrink in the postmenopausal period when there is no HRT. And if there is HRT, hormone replacement therapy, there is estrogen, then it may increase in size, but in the absence of HRT, it must decrease in size. Question number 60. A diagnosis of invasive breast carcinoma is made. What is the most likely pathological type? Ductal carcinoma in situ. Because most common likely pathology of invasive breast carcinoma is ductal carcinoma in situ. Question number 17. Mammogram should have intensive invasive carcinoma in area of the calcification. What is the most likely morphology of the calcification? Linear branching. This linear branching morphology of calcification in invasive carcinoma of the breast. Question number 18. Mammogram shows abnormal areas of multiple microcalcification. Incidence with invasive carcinoma. How large is it most likely the calcifications were? Less than 0.5 mm. Because microcalcification means less than 0.5 mm. Macrocalcification means less than 0.5 mm. Question 19. Mammograms of metastasis from a primary. What primary is she most likely to have? Metastasis to breast from primary is lymphoma, melanoma, ovarian carcinoma, and lung carcinoma. Remember this mnemonic LMNOP for lymphoma, melanoma, ovarian carcinoma, and lung carcinoma. These metastasize to the breast, and breast first metastasize to bone. Question number 20. Which one of the following time enhancement curves would be most likely to represent malignant lesion on the contrast enhanced T1 subtraction sequences? Answer C. It is the option in which there is rapid washout. For example, the time enhancement curve of malignancy is rapid increase or slow increase with time and rapid washout. This is for malignancy. Question number 21. Histology shows papilloepithelial carcinoma with a leaf-like growth pattern, but most likely diagnosed by large tumor. Leaf-like growth pattern is seen in large tumor. Question number 22. Man with an abnormal karyotype with a left breast lump having invasive ductal carcinoma. What karyotype is he most likely to have? 47XXY. This for diagnosis is Klinefelter syndrome because of the breast lump. And 46XY is normal, so 47XXY is ductal carcinoma, is Klinefelter syndrome. Question number 23. Histology and exudate abnormal malignancy. What is the appropriate management? Breast MRI. If there is an exudate abnormal malignancy, breast management, breast MRI. Question number 24. Which finding on ultrasound is most likely to indicate a non-viable pregnancy? Non-visualization of cardiac activity on ground and length CRL is 7 mm. Because in 5 mm size, we do not visualize cardiac activity. But when there is no cardiac activity within 7 mm, then it means it is non-viable pregnancy.